This webinar, Tech Accelerates Disability Resources in Disasters, which took place on December 2nd, 2020, is the result of a collaboration between the San Francisco Tech Council and the World Institute on Disability. The SF Tech Council is a mission-driven, multi-sector initiative that brings together government, business, nonprofits, and consumers to advance digital inclusion for older adults and adults with disabilities. Launched in 2015, SFTC works to address the complexities of connecting all San Franciscans and to harness opportunities for innovation. The Tech Council is the community table around which member organizations and supporters sit for that very purpose. The webinar includes the Global Alliance for Disaster Resource Acceleration, GADRA, Founders Circle members, and was introduced by Nicole Bohn, Director of the San Francisco Mayor's Office on Disability. Technology, including assistive technology and effective communication access, is a critical aspect of GADRA and all successful disability inclusion efforts. True diversity, equality, and inclusion must include disability, and that can only be achieved with accessibility, including technology access. We hope you enjoy this webinar.
Thanks too to the Tech Council for putting on this great panel. I'm really looking forward to learning from everyone this afternoon and evening. So I was asked to say a few things by way of introduction to our event. So my office, I am the director of the Mayor's Office on Disability in San Francisco. And what our office does is serve as the city's overall ADA coordinator. And as part of that charge, we are fortunate to have disaster response and coordination directly as part of our charge. And because of this, we've had an opportunity to be directly involved with our COVID Command and Response Center here in San Francisco. But even with that direct presence, which not all jurisdictions are fortunate enough to have, we know that we have more work to do. We've learned a lot of things, and we know a few things too. We learned right away, of course, that we needed to pivot in response to the pandemic, specifically for folks with disabilities. And we did that in the beginning with putting up access to programs about access to food, shelter, PPE, transportation. But now as we're moving into the response phase, what we're really learning and understanding is that we now also need to be thinking about what does it mean for people with disabilities to be able to be engaged and active in a safe way. No one likes to equate the words disability and vulnerable ever, least of all me. But we do know that people with disabilities are more vulnerable to the pandemic. And as such, many people with disabilities have really changed their lifestyle. And we need to respond appropriately so that folks with disabilities have all of the resources that they need. But we know also that we can't do this alone. We need the partnerships like those that you'll learn about on today's panel. So with that, I'm very pleased to hand it over to Marcie.
Well, thank you very much. This is Marcie Roth speaking, and I'm the Executive Director of the World Institute on Disability. I'd like to thank the San Francisco Tech Council for inviting us to join you all today and for such a warm welcome from Nicole and the San Francisco Mayor's Office. We are really pleased to have the opportunity to talk with you all about a global initiative, the Global Alliance for Disaster Resource Acceleration. And I will tell you a little bit more about GADRA, which is what we call the Global Alliance for Disaster Resource Acceleration, in just a moment. But we're going to begin by sharing some music The song that you're about to hear was written by the award-winning filmmaker and musician, Jennifer Musumba. And I will turn back so that you can hear the song.
At one time we were invisible, waiting on the sidelines just to get told it'd be best if you just stayed home. So you can't do what we can do. You're broken and weak, just look at you. But if a life ain't worth something real and true, rise up. Maybe it's time to go a different way. Raise up the youth to make a better day. We've all had struggles in our way, but we believe, rise up. See, it's time to write a new song. Broken and weak, yeah, you were wrong. We're taking our place and we're standing strong. Next generation's got something new. They've got a fire from inside and a will to do the work that we started with a fresher view. Rise up. Yeah, it's time to go a different way. Raise up the youth to make a better day. Yeah, we've got struggles in our way, but we believe, rise up. We belong, we are strong. Rise up. We belong, yeah, we are strong. Rise up.
Woohoo! This is Marcie speaking again, and Jen is most definitely a gift to the Global Alliance for Disaster Resource Acceleration, and someone I'm sure to keep a real good eye on moving forward. The Global Alliance came as a result of a 20-year recognition that people with disabilities and disability-led organizations were continuously excluded from accessing humanitarian assistance to address their needs during disasters. We formed the Global Alliance very simply to bring together corporate and foundation partners with disability-led organizations and our allies and our accomplices. And the Global Alliance is matching folks to direct, immediate, urgent, rapid support to local disability-led organizations. Very briefly, we currently have been in the process of matching our colleagues from Bristol-Myers-Squibb with MAVI, the Independent Living Center in Puerto Rico. Bristol-Myers-Squibb is as well working with us on rapid response after Hurricane Iota in Central America. AT&T is looking for a match in Seattle, and we're working on that. Benetech will be working with us on an initiative in Northwest Nigeria. And we've had folks who have joined us from 69 different countries as we have been building the Global Alliance. At this point, I'm going to introduce you to today's speakers from the GADRA Founders Circle. And I will let them introduce themselves, but you will be hearing from Susan Mazrui from AT&T, KP Naidu from Benetech, Germán Parodi and Shaylin Sluzalis from the Partnership for Inclusive Disaster Strategies, who is our co-founder of the partnership of the Global Alliance, GADRA, and Tinamarie Duff and Leticia Ferri from Bristol-Myers-Squibb. So shall we start with Susan, who will talk a little bit about why she's here.
So AT&T has a long history of supporting communities. And one of the things that we've been very proud of is our ability to respond during disasters. A big part of how we respond, though, and how effective our response is, really has to do with those in the community who are providing direct service. We can easily discount things for services, for example, for first responders or people in medical care. That's relatively easy. But when it gets to doing things like providing accessible cell phones for folks in the middle of a hurricane, we don't necessarily have contacts in the environment that we know we can rely on to distribute the devices to people who are most in need, who can perhaps address some of the disability related questions, like how do you use a cell phone if you can't see, and really have a sense of what the priorities are. For example, maybe someone who is medically fragile rather than someone who just happens to be a neighbor who has a mobility disability. And so we were very excited about GADRA because we know, as dedicated as we are to serving our customers and serving our communities, we can't be everywhere and everything for everyone. And so having this network where there's a need identified, we can help fill the need, and we know that the efforts we're making are making a difference for the people who need help. And so we were very excited about GADRA. We're very excited about the work that's done with the World Institute on Disabilities. We know without leadership from the disability community, when it comes to disaster response, a company like AT&T just does not have the network that's needed to reach out to the individuals who are most in need. So we were very pleased to join GADRA, and I think you will thoroughly enjoy hearing what's happening. It's very productive. That will make a difference for people in disasters and getting the help they need as quickly as possible. So thank you.
Thank you very much, Susan. And now we'll turn to KP, who will speak to us.
Thank you, Marcie. So this is KP Naidu from Benetech. I'm really pleased to be here. Thank you to the SF Tech Council and Marcie and to the Mayor's Office and Nicole for giving us this opportunity to be here. And Marcie, we're really happy to be on GADRA. You know, one of the things, we're a tech organization, and our goal is to bring Silicon Valley technology smarts and apply them to solutions which will help people with disabilities, people in the underserved, if you like, population, whether it's poverty alleviation or human rights, to actually live really better and fulfilling and productive lives. And so that's kind of what we do. And the three pillars which we have are inclusion, equity, and justice. And with regard to inclusion specifically, we have, we want to enable people with disabilities to be able to not only understand what their rights are or what facilities are available to them, like Susan mentioned from AT&T that, there's a phone available which they can use, but also we have a platform to enable people with disabilities to actually report on their day-to-day lived experience. Because we believe that the lived experience, first of all, for people with disabilities changes rapidly, and even more so during a disaster. So things which were kind of taken for granted in their day-to-day life now disappear, whether it is the roads disappearing, floods, just services which they rely on. All of these will change. And so for them to be able to report on what they're facing, what they're seeing in front of them today, this hour, and making sure that that information gets to the right people who can respond, whether it is the first responders, whether it is service provider organizations, or other organizations who work, in disaster areas. That is what we're about. And also, I just want to make one more comment, which is we're trying to move away from this notion that somebody with a disability needs a quote unquote accommodation, because that in some ways is an afterthought. So from a technology perspective, we're trying to make sure that whatever we develop, and we're not perfect at this, but we're trying to make sure that whatever we develop is accessible from the get-go. It has to be designed right from the time it is built so that people with either a visual impairment or any other, like intellectual disability or any other disability, will still be able to access and use the tool. And with that, I'll turn it over back to Marcie.
Thanks so much, KP. Our next speakers are Germán Parodi and Shaylin Sluzalis from the Partnership for Inclusive Disaster Strategies.
Hi, everyone. My name is Shaylin Sluzalis.
My name is Germán Parodi.
And we are the co-executive directors of the Partnership for Inclusive Disaster Strategies. And the partnership, as we are known as, is the one and only disability-led national organization located here in the U.S., focused solely on the rights and needs of people with disabilities, people with access and functional needs, and older adults before, during, and after disasters and emergencies. This includes, as we all know, people with disabilities being the experts of our own lives. We are disability rights experts before, during, and after disasters. We're capacity builders and community organizers, and we are the boots and wheels on the ground response. So what makes us different from other organizations, other relief organizations, or advocacy other organizations, is that we do that direct relief response for people with disabilities, led by people with disabilities.
Today we are joining you on the eve of the International Day of People with Disabilities. We look forward to talking more and sharing how having access to IT and information not only is life-saving throughout what are known as natural disasters or perhaps conflict, but especially now through the pandemic. Looking forward to a conversation tonight with you all.
Thank you for having us. Back to you, Marcie.
Thank you very much, Shaylin and Germán. And our next speakers are Tinamarie Duff and Leticia Ferri from Bristol-Myers-Squibb.
Thank you. My name is Tinamarie, and I'm with Bristol-Myers-Squibb. I'm a Caucasian female sitting in front of a Christmas tree and a Bristol-Myers-Squibb sign with long brown hair, middle-aged. So I'd like to just quickly introduce myself, as I just did, and the company, BMS, and we are really excited to be partners with GADRA. At Bristol-Myers-Squibb, we view diversity in the broadest sense, including age, ethnicity, race, culture, gender, identity, and expression, sexual orientation, abilities and disabilities, religion, socioeconomic backgrounds, veteran styles, veteran status, thinking styles, and life experiences and other differences. And so we have 8 people and business resource groups, and they represent a key strategy that we use to support the business objectives, career advancements, and development of our employees. Our employees voluntarily come together around a single dimension of diversity to help drive business results. And the members network and they learn skills and they participate in activities, but we also like to take that work that we do and we expand it beyond the four walls of our organization. I lead DAWN, which stands for Differently Abled Workplace Network. It's a global PBRG. The DAWN mission is to foster an environment and a workplace culture that promotes the value of the differently abled individuals and their impact on BMS and business. And we have over 2,300 members around the world, including chapters in Puerto Rico, England, Ireland, Brazil, Argentina, Korea, France, and more. And we recognize that during the time of crisis, the disability community is often impacted disproportionately and left behind, many times without aid and resources, as some of the speakers before me have shared. The global COVID pandemic has further exposed persistent health disparities and leave under-resourced resources and minority communities at a greater risk of poor health outcomes. And now more than ever, we recognize our role in creating the change that we need to help address these health disparities and also the racial inequities present in our rapidly changing communities. On August 12th, BMS and the foundation and the Bristol-Myers-Squibb Foundation announced a new combined investment of $300 million as part of a series of commitments to accelerate and expand health equity and diversity inclusion efforts. And I'm also happy to share on behalf of BMS and the Bristol-Myers-Squibb Foundation and DAWN that employees who donate to the WID organization, that we are matching their donations 2-to-1 through the BMS Foundation. And we are also partnering with GADRA, as Marcie has shared, in many of our areas and countries, and to prepare for the next disaster or pandemic or need of the community so that we can be ready with boots on the ground, both as an internal organization to support the community and our employees, but also to support the work that GADRA does. And a great example of this is the work that we're doing now. So I'd like to introduce my friend and colleague and the lead of another one of our 8 PBRG groups, Leticia, to share more about.
Thank you all for the invitation. It's a pleasure to be here talking to you today. So as Tinamarie was saying, I am her very good friend, right? It's important to have friends at work and my colleagues. So I am the lead, like as Tinamarie was mentioning, BMS, we have 8 PBRGs, People and Business Resource Groups, and I'm the lead for OLA. OLA stands for Organization for Latino Achievement. Similar to Dawn, what I do on OLA and the mission for OLA is really to support the company objectives while ensuring we bring the awareness, cultural awareness, inclusion of the Latinos, and of course, talking about our commitment on health disparities to ensure as well that our work goes really beyond inside BMS, right? But how we are impacting our patients and really promoting health equity. So it's like Tinamarie was saying, kind of there was recently, 2 weeks ago, there was a disaster. The Hurricane Iota did hit the Caribbean region. And our colleagues in Colombia did reach out to me as the lead for the OLA, right, the Organization for Latino Achievement. They reached out to me to give me the heads up that had just happened, if there was anything that we could do. So just to give you some perspective, the hurricane hit the area in a Category 5 hurricane, did displace more than 150,000 people. And for some areas, some islands of the coast of Colombia, So for example, island of San Andres, the archipelago, that area in the city of Cartagena, were the areas were heavily hit. And not just during the hurricane, but also after the hurricane, they had very heavy rains. So, which just make it even much more difficult. And of course, thinking this population that have been affected are is more some of very poor areas in Colombia, so which makes the challenges and they really support it very heavily, and also talking about geographically, right, being on the island. So when they reached out to me, and then Tinamarie and I were in a call together, and I mentioned, okay, we needed to think about it, how we can support the team in Colombia. Tinamarie brought it to me right away. She's like, okay, we have this partnership with GADRA. And suddenly it's so amazing. And even today we were talking to the BMS team, say that's when we realize how it's a great company. And like it was mentioned before, how it's important to have partnerships, right? To know who to look at. So as soon as we start to talk to GADRA, we got the team in place. We got our colleagues in Colombia who have been able to help us to connect and point us in the right direction. So right now we are just ready to send out a communication to all BMS employees across the globe to announce our efforts and how Dawn, BMS, and GADRA is partnering and supporting to support these communities in Colombia. So I'm very happy to be here to share this. Like I was saying before, it's sad that this is a disaster that happened out there in the community, but I'm glad to see how we were able to put these efforts together very quickly and to mobilize our global community.
Thank you, Leticia, and Marcie and the team. I want to thank you for this opportunity. And I'm also more than happy to address a question and comment that came up in the chat. And I can do that really quickly. It comes up a lot. We do call ourselves Dawn for Differently Abled Workplace Network. And I know the disability community has a varying opinion on the term differently abled, and that's not for this forum. But part of the reason why we have chosen that, and I've chosen that with my team as a lead, is we are a global organization. And in some markets and in some countries, there's different preferences for terms. And so we have, and there's strong preferences on on being called disabled or differently abled. And I've chosen to for now keep that because as my team, my global team, and the 2,300 members, as we've surveyed and asked, and there's many parents and caregivers and allies, that was the preference of that team as a term that was encompassing everybody, that also include allies as well. So it's an ongoing conversation. When I refer to myself, I refer to it as a disability, and many times I will refer to, I say disabled, and I try to respect the opinion of everybody. But that is why, and I do get that feedback a lot, and I welcome, and I appreciate everybody for sharing that with me regularly when we do these calls. And I just like to share why we've chosen that term right now. But it is, like I said, we talk to our members, we get the feedback, and there's no solid great answer right now. But that's where what I've chosen to do based on the feedback from my team.
This is Marcie, and I want to thank all of our speakers for getting us started. And Tinamarie, thank you for following up on that question. Important question, important topic, and a discussion that I know we will all welcome continuing to have. I'm now going to turn to some of the questions that we've received, and I'm going to begin with a question for Susan. And that question is, why are companies like AT&T interested in GADRA? And I know you spoke a little bit to this already, but I think folks would really welcome hearing some more.
I think a lot of people in the business community assume that when they work with large organizations, national organizations that do disaster relief, that their programs are inclusive. And unfortunately, that's not always the case. Temporary shelters may not be wheelchair accessible. Information may not be put out in accessible formats. Interpreters may not be available. And that's just the reality of what happens today. And so if we're to be sure that we are reaching out to everyone, that we are really serving communities as a whole, and communities, of course, wherever you are, include people with disabilities. Sometimes it's permanent, sometimes it's temporary. And the best people to work with are the organizations that serve people with disabilities, organizations that are often driven by people with disabilities, because they have the connections and they have the expertise. You know, who better to know how to transport someone with a temporary mobility disability than someone who's worked in the independent living field for a long time? Who knows how to reach out to people who might have a vision loss or a hearing loss and not have access to some forms of communication like that are sent out, like letters or radio shows. And so we really find it critical, if we want to be inclusive, and AT&T and I think most other tech companies as well want to be inclusive. And unless we are intentional about working with organizations of people with disabilities and for people with disabilities, we can't be sure that we are being inclusive. And so these types of partnerships are so critical, and having a centralized resource where the connections are already made can help expedite the help that we can provide. So that's why we're interested in GADRA, and we think it's so critical.
Thank you very much, Susan. This is Marcie speaking again. And I think one of the things that has been a real strong example from AT&T's work, I've been working with AT&T for many, many years now. And, you know, the active involvement centering on Black, Indigenous, people of color, people who have intellectual disabilities, people who have psychosocial disabilities or mental health disabilities, people with chemical sensitivities, you know, some of the folks who are typically not readily included even in initiatives led by the partnerships between disability organizations and funders. You know, it's been very clear that in the work that GADRA has been able to do, we've had the opportunity, whether it's with AT&T or with our other partners, that we're not narrowly focusing on certain groups of people with disabilities. And I also just want to take, I only have a moment, but it's an important piece of this discussion. You know, we have been devastated in the disability community in the US and globally by the loss of so many people who have become ill from COVID. Often we are referred to as, you know, fragile and old and having underlying conditions, which is all code for disability. And in fact, as we have been reading quite regularly here in the US, and I think it's true in just about every country. The death rate among people with disabilities in congregate facilities, nursing homes, long-term care facilities, prisons, and other carceral facilities, psychiatric facilities, group homes, places where people are not living independently because those supports and services have not been provided to them in the community. Among these individuals, the death rate has been catastrophic. Some folks have called it a genocide. Some folks have called it herd eugenics. I would be remiss, and the World Institute on Disability would be remiss in this conversation if we didn't talk about GADRA's very specific commitment to centering our work on the people who are most disproportionately impacted. And GADRA was started for the current disasters and the disasters that will follow. COVID and concurrent disasters are very much at the heart of what we're doing. And our Founders Circle is really very centered on making sure that we are representative of the whole community and not just part of the community. Nicole, would you take a moment and talk about what advice you would give to people with disabilities who are not currently connected to a particular disability organization?
Hi, everybody. Sure. I think one of the things that we've learned is that because we know that disability organizations do have mechanisms to get information out to people, if you're a person with a disability who has chosen for whatever reason not to connect to a particular organization, I really do recommend that you do find one that you have some affinity with and connect so that then you can be connected to resources. I say this because one of the things that's really been really come to light as working for the city is that we have a good idea of where people with disabilities are and how to get information to people with disabilities who are already connected to a city program or service like IHSS or Meals on Wheels or any other city program. However, these programs do not involve everyone in the disability community, and they are often also targeted at low-income individuals and are very important for that particular demographic in particular, but we're not reaching everyone through the resources that we have in the city. There are many independent living resource centers across the state of California and indeed across the nation. And that is one place to start. But there are many other organizations like the ones on this panel that I would really strongly encourage everyone to find one or two or all to connect to. It's very valuable.
Germán and Shaylin, what are some of the barriers that people with disabilities face when accessing technology during or after a disaster? How has assistive technology benefited people with disabilities in disasters? And what are some of the misconceptions that people might have on what happens to people with disabilities and their equipment and or assistive technology during a disaster?
Some correlations actually can be learned. Oftentimes, as we've experienced personally in following Puerto Rico after Hurricane Maria and Hurricane Dorian in the Bahamas, the technology and the equipment that people with disabilities use to interact with their community and with the world, maybe it a wheelchair as I use being a quadriplegic, or a digital smart device that my sister-in-law uses to communicate with us. Not only does it get damaged, and there are across the world, the region, and even the US, different systems that are not immediately reliable for replacement of this truly, I have to say, life-sustaining needs. In Puerto Rico, we saw countless people that, due to losing their equipment and the humidity in the island, were developing ulcers and other issues that exacerbated their health care and thus the system's health care to then deal and treat new incoming issues. Similarly, in the Bahamas, not only did we learn that similarly losing the equipment, but in the moment of the disaster, having proper communications in a easy to read information could have saved countless lives, specifically in the deaf community, of information relay not taking place properly. Now, as Leticia was explaining, we supporting from organization and our work with GADRA have reached out to DPOs in Guatemala, Honduras, El Salvador, of course, Nicaragua as the center, ground zero of IOTA, but the entire region of Central America, as Costa Rica, Panama, Northern Colombia, and as Leticia mentioned, the archipelago of surely San Andreas and Providencia. We've reached out to DPOs across the region, and one repeated statement across, very relevant, is the need for, as Susan was explaining, replacement of even smart equipment. The disaster has made what they had lose it. Which have been numerous this hurricane season. Ongoing storms and the pandemic, forcing people to lock down and social distance, has resulted, we've learned, into many school age students and college students have to not attend physically their colleges and their schools, not have access readily to equipment that they could have internet provided. So we hope and I look forward, as we learn the capacities to transport and needs, that we can supply this as we learn across the region to people with disabilities, many with developmental disabilities. So we don't have an ongoing catastrophe upon our hands of losing a generation in having them access to proper education as well.
This is Shaylin, just to add as well, people with disabilities, I think this is something that not everybody is aware of or realizes, that people with disabilities are 2 to 4 times more likely to die or be injured in a disaster. And this is largely due to the lack of resources and supports in their communities to meet the immediate needs of people with disabilities in a disaster. As Susan mentioned early on, that people that use wheelchairs may get to a shelter that is not accessible. You may get to a shelter that you can get inside but cannot get throughout completely and access the bathrooms or the eating areas. And we often find that when we include people with disabilities at the table, at the planning stages, at each and every table, and working with our partners throughout at every level, that we really make that difference of ensuring that people are thinking about those shelters being accessible and making sure there's a ramp and that it's accessible throughout, and ensuring that there are ASL interpreters at shelters or other forms of communication, and ensuring that those pieces are in place so that when a disaster strikes and people with disabilities have to leave their equipment behind because it's life or death and you choose your life and safety first and everything else last, oftentimes our equipment is left behind and it is hard to replace in that immediate time, and you still need to be able to communicate with one another to meet those needs and make sure that your rights are upheld throughout those times. So I really encourage folks to reach out to us at the Partnership for Inclusive Disaster Strategies. You can find us online at disasterstrategies.org. As Susan mentioned early on as well, oftentimes we hear that folks have a hard time finding those local disability-led organizations. And we at the partnership really help build those gaps and build those bridges between folks at all levels, to their local emergency management planners, to folks trying to help throughout disasters, to the people that need it the most.
And with GADRA and our partners, ensuring that funds do go down to those organizations doing the real work, working with their disabled communities. And throughout Central America, following IOTA, many people from indigenous communities with disabilities that are being underserved. There are communities, there are DPOs in the area that are serving the communities, and GADRA looks forward to being able to build those bridges.
Thank you both very much. This is Marcie, and I'm going to follow along that question. The next question is with KP. During a disaster, many services such as power, internet connectivity, and so on become unavailable or stressed. How can technology help overcome some of these challenges?
Yeah, thank you, Marcie. Great question. And this is one which I've dealt with, extensively for the past 20 years or more. It starts basically with design, right from the get-go. We had a comment earlier on. Susan mentioned about AT&T, and one of the things which companies like AT&T and some of the other larger companies have been doing, and even more so now, is actually demanding of their suppliers and vendors who work with them and their partners to actually include features which take into account disabilities right from the get-go. Because I can tell you as a technologist, this is not a primary focus for most developers of technology. Many of them view it as an afterthought or something to be put after they build the product, and then they will build it on. So the key thing is to kind of think of it right from the beginning. And also things like, we've dealt with how do you make sure that the technology works in low power situations, or that their power lasts for a long time so that people in disaster areas have the ability to use technology for a longer period of time? How do we ensure that designing from the initial design to make sure that they work in low bandwidth situations? Or, typically we've seen, for phone networks, for example, during a disaster, everybody is trying to use their phone and call their relatives and their friends and let them know that they're safe or ask for help or whatever. And so if there's technology which is built in, even if it's an app or whatever, to make sure that those apps work even when the networks are stretched, and they can continue to do that. Because very often for somebody with a disability, the ability to communicate could be could mean the difference between life or death. And so it's really, really critical. I think Shaylin mentioned that during a disaster, people with disabilities are 2 to 4 times more likely to die during a disaster or suffer badly during a disaster, and that's true. And so for them, this is my mantra to technology folk and my team, as well as anybody I talk to, is basically this: is that from the get-go, you have to design for accessibility, and you have to design it for people with disabilities. It is not an afterthought.
Thank you very much, KP. I hope you all can see what an amazing team we have coming together and tackling some of the most confounding challenges of our time. I'm going to now ask Tinamarie, what have you, what has business and what have organizations been learning from COVID-19 that may support, rather than building back better, that instead we start to move to building forward better? And how can business better support people with disabilities returning to work?
Thanks, Marcie. Well, I think the pandemic and all that we've been through as a world over the last several months has really created more compassion in the workforce and a level of understanding that I don't think was there before, particularly with individuals with disabilities, because what is a norm for many of us is what is a new norm for the rest of the world, right? So we all are wearing masks right now, versus if you're immunocompromised or going through chemo, and the community wearing a mask. Prior to the COVID, we saw an increase in mental health. And I think the World Health Organization said that 2020 it'd be the #1 workplace disability, and that was prior to the pandemic. And now with the pandemic, we're seeing a huge increase in mental health, right? And organizations like the Crisis Text Hotline, which is a nonprofit provider that provides free mental health via text messaging, they're seeing a 39% increase from Asian Americans, and we know that on top of the mental health crisis, there's additional barriers. Like some organizations don't offer in language, right, for Asian patients, or there's stigma associated with mental health. So now that all of this is kind of coming out in the open for everybody and equaling the playing field, I think the businesses are driving more to support their employees in ways that they have never done before. So KP just talked about technology. You're seeing huge, speedy advancements in technology. Everything's being closed captioning. The original thought of, you have to be physically present at the job site to do your job has gone out the window. And we have worked with accommodations so that everybody can work from home. The increase in mental health support, family caregiving support, elder caregiving support, that companies are applying and delivering and giving to their workforce has been amazing. And I think what this is doing is it's creating this realization that we can do our jobs in alternative ways. And it just opens up the door for the disability community. We know that even in the G10 countries, 70% of individuals who are able to work are not working with a disability. Those of us who have a disability are just not employed. And that economic empowerment and employment empowerment is really the next call to action. So as more companies and businesses become aware of how to do business and accommodate individuals and realize that everybody's still contributing, everybody's still working, everybody's still getting the job done, I think it's creating additional value in an untapped workforce that has not been necessarily perceived as being either capable or accessible or able to be accommodated. And now we're making those accommodations for everybody. So I think we're going to see a huge change as a result of what we've learned from the pandemic and the COVID-19.
Thank you very much, Tinamarie, and the work that Bristol-Myers-Squibb is doing and your incredible support for us, I think is just such a great model for the kinds of partnerships that can really lift up the whole community. We are extremely grateful for your support for us and for people with disabilities globally. We are now out of time, and we do have a couple of important wrap-up points to make. Our next GADRA town hall will be February 18th. It will coincide with Black History Month, and we'll be centering emergency preparedness disparities experienced by multiply marginalized people with disabilities. More information to come. We'll be in the second quarter of 2021 convening a summit for corporate disability employee resource groups to brainstorm ways that employees with disabilities around the world can share best practices like those of Bristol-Myers-Squibb that you are learning about tonight. And later this month, you'll be receiving a link to the entire GADRA Youth Leaders panel that debuted Rise Up, and we'll be sending that very soon. Thank you all so very much. Great questions. And we look forward to opportunities to work together with all of you. If you would like to become a member of the GADRA Founders Circle or get involved with GADRA, please do let us know. And I believe you have all those links. So back to our hosts, and we'll let you all say the final goodbye.
Thank you so much, everybody, for joining us this afternoon. We've had an amazing panel, great information about resources, and a really great resource to share. We'll be getting out a resource sheet too with all of these links that have been provided, as well as the announcements. I'll be making clips from this video, so this will also be available to you. And feel free to share widely with those who you know would be interested and could benefit. And again, thank you from the SF Tech Council. And I put again our information. If you're interested in learning more about us or collaborating with us on events like this, please reach out. Thank you so much, time, for this amazing event. Thank you for being here.